Okay, record. Okay, and
Just make sure the numbers are running, and you know what I mean.
numbers are running. Okay, good.
Numbers are running. Okay. I guess we're ready.
Okay, we're good to go. We're good to go. We're good to go. Vincent, Guinevere, can you just say something very quickly? We'll get Vincent off
Good
the screen.
morning, everyone. How
Beautiful.
are you?
Excellent. Okay. Good morning. It's Brian here. You are on our investor podcast, and that means that you are interested in investing in early stage companies with the hope and the wish and the dreams and the expectation that these companies are going to grow into phenomenal companies in the future that are going to give you a phenomenal return. Every week, we promise you another incredible company, a company that we have invested in ourselves. We are not promoters, we are investors. And that means that the companies that I bring to you are the ones that I believe are going to break through because we have invested our hard-earned dollars into these companies. Now, we're going to start off this morning with a phenomenal company in the healthcare space, and I'm going to bring Guinevere in from Sage Medical. Good morning.
Good morning, Brian. How are you?
I'm actually fandabidozy because we're going to talk about your scaling company, which is doing great right now, and I just have such hope. I have such hopes for, because look, I don't want to take all of the fun away from what we're going to talk about, but every time I think of you, I think of every single bad hospital bill, mistake, interaction, and everything that I've always received, and the fact that you're fixing this and that you're going to be creating a system for all of those people in America, which is everybody who has received incorrect information from their healthcare systems. And that's just the beginning for where you're going to. So I'm excited, and I'm looking forward to everybody finding out your whole journey. So the idea behind this is that we're going to bring you through the hero's journey. And that means we're going to start at the beginning. We're going to talk about where you came up with the genesis of the idea for what you've created. We're going to talk about some of the detractors and the hard points at the beginning that just you had to break through, and then those were forces that need to be broken through. And then we're going to talk about like how you came to today, and then the vision of where it goes to in the future. And then the majority of the folks who are listening to this, who are investors, will get a really, really good feel for how you're building your unicorn. Sound like a plan?
You got it. Happy to be here.
Wonderful. So take me right back to the start.
Absolutely. So I am a medical coder by trade, and in a short period of time, I was able to quickly identify the frustrations of not only the patients who are receiving the incorrect medical bills, but the entire medical staff working with the within the doctor's office, moving on to the doctor's frustration with the amount of data entry that they're having to do during a patient encounter. Because physicians didn't go to medical school for 12 years to spend the majority of their day doing data entry. But the real kicker was when I discovered that the medical billers and coders are creating approximately $100 billion a year in mistakes. And at that point, I realized this is absolutely unnecessary. And with the AI-driven platforms and technologies available today, there's got to be a way that we can fix this problem. And that's when I contacted a software developer, and I said, how do we fix this problem? And together we designed a plan, a strategy to come up with a very easy to use app that allows a physician to simply press a record button, record an audio file, and we take it from there. We've automated every step of the EMR data entry, medical coding, and billing, all into one fully baked real-time platform.
First of all, how did it get so bad? I get it, right? I get it why it would be challenging for doctors and doctors' offices to be able to input all of the information, but it's almost always wrong. It's not just it's a little bit wrong. It's just we're now so used to it being wrong that we're just wondering how far off it is. Is it really that complicated for them to fill in this information? And why has nobody tried to fix this so far? Or shall I say, why has nobody effectively been able to fix this so far?
So there are three essential pieces of this puzzle. So there are three different things that needed to be fixed. And the primary, automation or fix should be within the medical coding industry. And there's two reasons for that. One, the medical coding industry is just completely underserved. There's not enough medical coders. It's a really boring job. No, nobody seems to want to do it. It's very repetitive. I personally really enjoy medical coding. I see it as problem solving, as a mystery that, will have a solution. But the challenge is a lot of medical coders also work from home and are, unmonitored, and the doctor's office. So when the medical coder creates the code then goes to a biller, and the biller assigns a fee schedule to that code. So here's what ends up happening. A physician sees the patient and types in all of the patient encounter information. The coder goes in and has to identify certain words that are recognized, or that become a diagnostic code or a procedural code or something to that effect. So at that point, if the medical coder is lazy, they'll instead of doing the work to generate the 4 codes that should have been generated, they'll generate 1 code. And then that goes on to the biller sends it in, and guess what? Medicare or one of the other payers will pay it, and the physician gets paid. Now, what the physician did not know is that the physician should have been paid for 4 different codes, right? But the claim was not rejected. The claim was accepted, it was paid, but it was only 1/4 of the claim was paid, as, rather than all, the complexity that the physician had performed was not paid in full. And that's not the fault of the biller or the physician, it's the fault of a lazy medical coder. There are other complications where a medical coder simply makes a mistake, and that will also cause the claim to be rejected. And at that point, this is the physician's office now has to pay twice, right? They have to pay to have the same job done twice. So if we don't have enough medical coders in the industry, and the coders that are coding are a bit lazy, and if they are great coders, we're still only coding at an 85% accuracy rate. So would you accept that from a pilot, right? If the pilot was only landing the plane 85% of the time and crashing the rest of the time, would you find that acceptable? Of course not. And you can see the reality of this because you or someone has absolutely received 1 or more incorrect medical bills. And that causes a lot of frustration for the patients as well.
And you know what I love? I love frictionless innovation. I really struggle with disruption. I think I'm getting a bit old for disruption because everybody fights you, right? You have one stakeholder who are entrenched and they're making the money that they make and they never want to let go. Or you've got 3 or 4 people who will cause you problems. But in your particular case, there's literally not a single stakeholder that doesn't want to get this fixed. The physicians want to get it fixed. They're losing as much as they're winning, and they don't even know what's happening half the time. So they lack structure, which is the worst thing for a physician to even think about. Definitely Medicare, National Health Service, private healthcare folks as well. Like, they desperately want to fix this because they have no control on a system which is directing 70 to 80% of all of their costs. The consumers feel just lost because they don't know what's happening. I literally had a bill for a COVID test that I did, which was an emergency test, for $1,200 that came through from Kaiser Permanente. But it wasn't that the coder got it wrong or maybe the physician. It was that Kaiser Permanente actually processed the bill and sent it over, which means that it's not even just a question of, oh, the coders may do this. It's a question of within every single section of decision making, there are folks that are not at the higher end of the hierarchy. And those folks are not necessarily incentivized to do the work to fix what might even be an obvious error in many cases. So this is a massively, horribly, nastily broken system where every single part of the system wants to have it fixed. Like, am I wrong here?
You're absolutely correct. And that would lead me to your second question, which is why isn't anyone really fixing this? Now, the process I'm describing typically takes 8 steps. So you can imagine the possibility for error within those 8 steps. Not only that, typically this process takes weeks or months, right? Because it's exactly as you said, it's going from one desk to another. So we instead have synchronized medical billing and coding in a value-based approach that allows it to happen in real time. and without the human error. So what has not been identified in the past, and what makes my product much more unique, is simply that we've merged these three challenges into one, and we've executed it through an AI algorithm.
Wow.
So that has greatly improved, the solution to this, monstrous challenge. Now, in the past, there have been people who have worked hard to perfect, a dictation software, and then someone else is working on something similar to a coding, solution, and somewhere else, someone's, trying to work with a, streamlined billing, right, to allow for fewer mistakes. But I've yet to come across anyone who has, merged these three technologies into one and allowed it to operate in such a streamlined fashion.
And so when you first saw this, as I'm sure lots of other people did, you thought, this has to be fixed. Like, we have to come up with a better system to do it. But one thing is saying, I have experience in it. You have a tremendous amount of experience. Like, you have massive domain experience in the space. And I see a problem which nobody out there is fixing to any kind of acceptable degree right now. But quite another thing is then being able to build the software that enables this to happen. Like, that's a huge lift. So talk to me about the challenges that you faced while actually going through that, because I'm sure we could take up the whole rest of the podcast.
Yeah. That is very true. Now, the tech industry is a wild ride, right? There are so many different variations of technologies being developed across the board. I was fortunate enough to come across a group who did a really great job building the baseline for what we needed. But when it came to the AI expertise, that had been my biggest challenge, because this group simply handed me back the stack of code and said, hey, we're not AI guys. So I was a bit shocked that how that ended up happening. But the good news is there are, a lot of other people who are working very hard in the AI, community, and are, can help solve this problem. So I've turned to another group out of Minneapolis that specializes in AI healthcare, and together we were able to build this, delivery platform.
And you bring up a great point. Very few developers know how to do AI, real AI. Like, they're fine doing algorithms or APIs that are built in, or rule-based, you do this if I say this, but actually building an intelligent system in that actually allows for the system to be able to help make sure that it's done accurately and correctly without you having to interfere every 5 seconds is incredibly difficult. So you started off yourself, you started to build it, to put it together. What were the hardest parts of it, other than finding the AI company to come in? What else was challenging, really challenging? Like, I want you to take us to those moments of anxiety at the beginning when you thought, I don't even know this is possible.
Well, that's a really fun story, actually. So originally I had, brought the challenge to a tech. Sorry, the sun is moving around in my living room here.
You look amazing. It's like you're an angel, and you've got these rays of light.
Yeah, right.
Keep it. It's great. Own it. But and it's actually and I think it's a really nice time to have the rays of sun coming in that angelic type appearance when you're just about to talk about the depths of despair that you went through as you started out.
So that is a funny segue, but yes. Okay. So a few of the challenges, so the tech or finding the right tech team was certainly a challenge. Now, I've led teams of 700 people before in a national food franchise that I had created. I've I've procured bonsai trees. I was a bonsai master for a while. I'm a licensed drone pilot, so I've led a lot of, I actually was a fire eater in a circus in Europe for about a year. So,
Wow.
So I've done I have a variety, of a skill set. And although I knew getting into this, I'm developing a tech company, but I don't have a technical background. So that was a challenge. And when I was first handed back the stack of code and I realized, I can't read this. What am I going to do about this? So I went online. And I found out that YouTube has a series of classes to teach 12-year-old girls how to code. So I, of course, joined this class. I was the tallest one in the class, the oldest one, obviously. And I began, learning, learning through the class how to read a stack. So that was my first experience with, really digging in and understanding the technology itself, right? I understood exactly the problem I wanted to solve, but in order for me to choose a better tech team the second time around, I needed to understand the tech. So that delayed the project by about 5 months, but I feel it was well worth it because now I have a true understanding and I can actually evaluate a lot of the tech that's being developed for Sage Medical. So that was a challenge. Now, what I see in the future, because we will go to market and we will scale this incredibly fast, right? There's not a single EMR company out there that would not want to use this platform. So the second challenge is, hiring in a good devs team in-house, right? So basically I feel like that will be the next challenge is, hiring in people that.
Before we get there, just take me to the dev team you chose outsourced first. So you wanted to make sure that you had a base level yourself. You wanted to make sure you said, I know the problem, I know the solution, I know how it needs to look. You could probably have wireframed the entire thing yourself, but you needed to get a dev team and the AI team, to your other point. Like, how did you choose the dev team, and how did your first dev team too on building the product?
The first dev team delivered the product, I would say about 80% complete. So I feel that they did a fairly good job on the build. But once they realized that the accuracy rate wasn't as high as had been promised, the product couldn't go to market. And that was huge for us because we had large investment groups looking, watching this build and excited for the launch. And, there's a lot of eyes on this project, right? A lot of people really want to see this succeed. Especially one of the advisors on our team, he oversees the medical billing and coding division of the second largest hospital in Southern California. And he called me up about 6 weeks ago, very upset because the state of California had forced a regulation stating that people could not come to work, I guess, or perhaps it was just I don't know. I don't remember the exact reason, but if you didn't have a COVID shot, you couldn't come to work in California. So what happened at this hospital was they lost 25% of their coding department. Now, this hospital on average every month receives a repayment from the payers, Medicare, all of collectively, the payers send in or refund about $70 million a month. So now, after the first 2 months of not being able to process at least 25% of their claims, right? They didn't have the coding staff any longer. They then began receiving repayments of only 43 million a month instead of 70 million. So that significantly impacted the hospital. So basically, the hospital began laying off staff and so on, simply because, if the coding doesn't get done, the claims aren't sent in, the reimbursements don't come back, and the hospitals just don't have the money that had been projected. So you can see how quickly this could spiral out of control financially for very large institutions.
Yeah, and the funny thing about this, normally when I'm speaking on the podcast with companies that we've invested in, we keep such a high focus on the size of the market, but it's not even a relevant conversation here. It's literally every single bill for every patient in every hospital or health institution everywhere in the entire country. I mean, it's just like there's not a single, and I'll always say, look, if your customer is everybody, it's nobody. But in this case, it's everybody, literally everybody all the time, because we need to have it fixed properly. So your size of market is not one unicorn. Like, your size of market is 20 unicorns, because the winner in this race is going to absolutely dominate. Like, there's no question. So I want to talk a little bit about the go-to-market strategy and what that looks like. And then I would love to talk about the competition that's out there, because that's genuinely all that any investors are listening to right now. They're going, she's incredibly strong, the incredible domain expertise. The product is monstrously needed right now. every single stakeholder is going to want it in. The only thing that matters is how strong the product is, how well it gets integrated, and how much competition there is out there to fight about it. So let's start with the go-to market, where the product is right at this precise moment, and how we get it in, and how you see the next year and 2 years for that.
You got it. So the medical insurance market is a $680 billion market, but 50% of that market is dominated by server-based software such as Epic and Cerner. Epic and Cerner systems cost about $20 million. So you can imagine a lot of the smaller physician groups, an allergist, a chiropractor, these people cannot afford that, those giant systems. So
Sure.
the other 50% of the market would be cloud-based EMR systems. So that would, to us, would be $340 billion market. So there are thousands of different cloud-based EMR systems out there. We are vertically integrated with 4 of the largest legacy EMR systems available. That gives us access to 2 million physicians. So our go-to-market strategy is to get this product in the hands of those 2 million physicians who we're currently integrated with.
And that's going to happen very soon, right?
That's going to happen very soon, correct?
So talk to us about when the product is going to be ready, what it's going to look like when it's ready, how close to it will never, I know you, so it'll never be 100% your satisfaction, but how do you see it coming to market? And then what does that outreach look like to those physicians? Let's say we're right now in the middle of March, that bring me through April, May, June, July, etc. for the rest of the year.
Okay, so in 10 days, we'll reopen our beta testing with the geriatric clinics that we're integrated with. So we want to run a quick beta and then a more direct alpha test to verify the accuracy rate of our product, right? Because we don't want to just be coding or we don't want to meet the accuracy rate of a human. We want to far exceed the accuracy rate of a human. So I won't allow this product to go to market until it's 97% plus accurate. Otherwise, it would be a helpful product, but not a disruptor. And this will I want this product to absolutely disrupt the market. I want it to fix the problem, right? I don't want it to just help out. So after that, we can then launch the product within the EMR systems first with all of the geriatric related physician groups, geriatric clinics, and so on. Now there are 2,800 different medical modalities, right? There's cardiology, neurology, and so on. So basically after we complete alpha and we go live with the EMRs that we're currently integrated with, then I will open a raise round of $750,000. That will allow me to hire on 12 more developers and who will each be assigned a different medical modalities and continue building recurring neural nets for each of those modalities. So essentially the answer to your question is this can go live very, 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 very fast if I had enough people building for each modality specifically, right? Because right now, if a physician sees a patient and says patient presents with pneumonia, we can 100% of the time code that correctly. But if the diagnostic is more complex, we need our system, we need our AI to be smart enough to recognize the variations of complexities, the syntax that the doctor is using, when recording the audio files and so on. So essentially we have to feed our AI a ridiculous amount of data, and we have the access to the data to do that. It's just a matter of organizing it. So the more people I can hire, the faster we can organize, the quicker we can dominate the market. So it'll basically come down to a funding stretch.
Wonderful. And then so I have so many questions that come from that. But of course, the wonderful thing about AI is it just becomes smarter when you start bringing in the real data as well. And then that's when it becomes a real machine. What's your feeling on the beta and on the alpha accuracy based on all of the experimenting that you've been doing so far? Because you've been working on this for a little while now. You've already been playing with it. You've got a good feel as to where you believe you're going to be. So we know that the accuracy in the market, and you haven't given me a number, but I'm guessing it can't be more than the 20s or 30%. I know that seems very
The accuracy rate of our current product?
No,
our current
not
product.
you. No, not you. The world.
Oh, the world.
Yeah.
Yeah.
There's a before Sage Medical and after Sage Medical time period, right? So before Sage Medical, I know there's no accurate numbers because it's every health system, every hospital, everyone, but I can't believe it's more than 30% accuracy right now today.
So I can give you a great example. So Amazon has a product, has a platform called AWS, and within AWS, they have a medical comprehensive cloud, a medical cloud.
Mm-hmm.
And they released a similar product that had been on the market for about, not similar, they released a product that did some coding, not the dictation, not the billing, but just the coding. And their product sat on the market for about 3 years. No one was using it because the accuracy rate was 40%. So this is a huge company with massive resources that spent millions just to build one part of our 3-part solution, right? And then what they brought to the market was a 40% accuracy rate. So they pulled the product since, and that's a perfect example. Absolutely.
And that shows how difficult it is. But we have to believe the market as it currently stands is probably in the 20, 30, 40% percentile of accuracy anyway. So this takes us to Sage. So when you bring your beta and your alpha, and I'm not going to hold you to it because that's why it's called a beta and an alpha. That's why when investors come in now, they get a better valuation than when you're a $100 to $300 million company within a short period of time. Where do you believe your accuracy rate is going to sit?
Currently, our accuracy rate sits at 96%.
Come on. I just like hearing you say it because it's a beautiful thing. And how did you do that? Like, how did you succeed so strongly where others have failed? And what's given you reason to believe that you're going to be at that type of level?
So back to the modalities, because of my true understanding of medical coding, of what it takes for the human mind to read a paragraph, right, of a patient file and be able to identify and assess, because it's not a keyword search, right? We don't just go through and say, oh, here's the word pneumonia, this is code J18.6. We actually have to read, it tells a story, right? We're seeing 82-year-old patient presents with diabetes. Well, I know that's not diabetes unspecified. I know that's geriatric diabetes, which is a different code than a child with diabetes or a pregnant woman with diabetes. So that's the complication that I knew needed to be solved, right? I knew that we had to train this AI to not only identify medical terms, but think like a human, right? They needed to identify it that way. Now, when we did our evaluation of AWS, that's basically what ended up happening. Typically, a patient file should have maybe 3 codes on average, right? 3 codes. And when we started running the tests through AWS, they were kicking back like 20, 30 codes. Wow. And you'll never submit more than like 7 codes. Like that's maximum from, a very incredibly complex scenario. So when we're getting back 20 and 40 codes through AWS, we realized that they were training their system basically just as a keyword search, right? So anytime any medical term was noted, they were assigning a code to it. Now, what would happen then is if the doctor actually used that system and sent in 20 codes, it would obviously, a flag would go up on the payer end. There'd be an investigation for overcoding and fraud. It could cause a huge problem. So that's why, we were able to identify, and it was great that they had spent millions, making those mistakes, because we were able to avoid them, right? We were able to see what didn't work within their platform. And we were able to say, okay, we need to train our software to identify it in this specific way, right? Outside of all of ignore all the keyword searches, identify it through this type of training, right? This type of recurring neural net, hybrid that we're building with an AI and ML technology.
Makes sense. How long do you think it will take to go through the beta and the alpha?
The beta, I believe, will only take about 2 to 3 weeks, and we'll know within the first 1,000 records what that accuracy rate would look like. So that would usually happen within about a week. We can compare. We usually have a baseline of at least the first 1,000 inputs to see what that accuracy rate is coming back like as, and then we just let it ride for the next few weeks and make sure it maintains that level. And then the alpha we would roll out to a much larger, like a skilled nursing facility or something, where we could see a variety of small and large inputs coming in. And then basically from there, just roll it out to every every geriatric clinic or geriatric physician, whether they're doing home visits or skilled nursing facilities and so on. So that's how we can have a true alpha result, is by really forcing the data to prove itself, right? And so from there, and so basically to go from there, now we want to do the same thing for every cardiologist in the country, every neurologist. And to make that happen, we have to hire in more developers who can, focus on, myopically focus on getting that percentage, over 97%. I really don't want this to go to market until we're at least 97 to 99% accurate. But we do want to build this for every physician, not just a small, handful of different specialty physicians.
As an investor, we do love obsessive people. Like I think I have a tiny bit of obsession in there, but you leave me high and dry. You're at 96% and you're saying it's not good enough. We need to make sure it's better and better and better and better. And that alpha, I'm guessing, I'll make two comments on this and then I want to jump into competition. But the alpha, I'm guessing, is going to run for the rest of the year as you continually learn, as you're pushing up that accuracy rate so you can just come out with nobody coming even close to you and on what you're doing. And then the second thing is, which is, I think, for investors that are listening here and they're thinking, okay, we have a great product. It's going to market now. We already have multiple proof points that it works on a really high level. The company are raising a relatively small amount of money. I will be, and I'll say this to investors, I will be encouraging the company to actually raise at a much higher valuation as we go into alpha, and I will be encouraging the company to raise a lot more money based on that higher valuation, because we don't want to slow down at all. We need to hit the entire country. We need to go after everyone. We need to hire sales teams. We need to hire groups. And in my mind, that number is closer to a $3 million raise, if not even a little bit above that. As soon as we show these numbers are being hit, then watch that market, because we're coming hard. And for any investors that are the earlier stage investors, watch that investors, because I believe it's going to be extremely difficult for you to get in the round. Right now, there is a small window of time, and I mean weeks to early months, where you can get in with the company, diligence what's happening so far, and really be a part of this as an early stage investor rather than get pushed out by the later stage investors later on. Any comments on what I just said?
That is our strategy. So the $750,000 runway will okay, let me throw some numbers at you. So out of the 2 million physicians we currently have access to, we only need to capture 7,000. Okay, out of 2 million, we only need to capture a user rate of 7,000 physicians to have $100 million in revenue. So we figured between the a $750,000 raise plus the our revenue, that we can hire on more developers and continue to scale very quickly. And then that's our plan, is to open a Series A at 5 million.
So and that would be towards the end of this year, beginning of next year, right?
That's correct.
And again, I'm thinking your Series A would be even higher than that. I think your valuation would go even higher than that because of the market side. Look, everything in this game, and this is not a game for you, but for investors that are investing, they're comparing multiple different investments that they can put their money into. So everything is a cost of return on investment. So from your perspective, the market is so huge. It's just about speed. This is just a game of speed right now, and making sure, to your point, that you have the accuracy level to the right stage. Once it's there, this is about throwing money at this to getting into as many physicians as humanly possible. Talk to me about the development of the team. So, and by the way, I have two more questions, and then I just want to bring it all the way back to this sounds like it's been really easy for you, and I cannot believe that that's been the case. So we're gonna finish there, and then also finish on just a big upside. But take me through those two areas first of all, and bring me to talk a little bit about the competition, and then a little bit about the scaling as well.
Sure thing. I'd like to wrap up the revenue conversation by saying, so this is the 7,000 physician users. So that's just our basic revenue stream, mostly earned through the billings and claims software. But we also have SDK licensing deals in place that other EMRs want to white label our product and launch internally within their systems. Then there's an entire other market of revenue, which are the actual coders, right? If we can put this app essentially in the hands of every medical coder who's out there, they wouldn't lose their job. In fact, they'd be able to code twice as fast and at a much higher accuracy rate. So they would be seen as even more desirable to their, the physician groups they work for. So there's many, streams of revenue. We're just, going with the standard 4% billing claim structure. But even at that, if we get a capture rate of 0.0001% of the market, we're still $1 billion company, right?
Yeah.
Because as you said, the availability of and the numbers that support the insurance, medical insurance industry are huge.
Yeah, and on one level, I don't even think it needs a conversation in your unique case, because literally every single investor will be saying, we see the size of a market. It's a monster market. This is just about execution. It's nothing else. I think what is interesting as you talk about it is the obvious accuracy that you have with your numbers. This is obviously something that you live every single day. This is not about we're going to go to the world, and if we just got 1% of the market, it would give us this. No, it's like you're talking about specifically who you're going after, how you're going after them, how many of them that you're going to get, why they're going to need you, what other areas that they're also going to require backup and assistance on. You've thought this through, and that's what every single investor wants to hear. So talk to me about how you're going to develop the team, especially the technology side of your team, which I know is top of your mind, and then competitors that are in the market that are in any way either scary to you or providing you with encouragement.
Okay. So as far as the team goes, so I am working with Lucian to come on board as the Chief Technical Officer, but he's interested in coming on board not only as a possible technical co-founder, but also as an investor himself. And he's running the team I've hired of AI specialists at the moment. So he's so dedicated to this project and so interested in supporting the scale of this product that he himself wants to really put some skin in the game and get involved. So that's our strategy for overseeing the tech and scaling, right? Bring in someone who isn't just being paid to do their job, but actually has a vested interest to move forward. So I'm very much looking forward to a partnership and a collaboration with Cardamom AI. That's Lucian's company, which is in Minneapolis. So
excellent, wonderful. And then the competitors out there, anybody that you're cautious of, or does every day just give you more sense to feel encouragement?
So on a really high level, I'll tap into each of the three things we do and who our major competitor would be. So now we threw in the dictation tool just to allow our product to be easier to use by physicians. It wasn't really something that we put a lot of focus on, but what makes our dictation tool different is we have a medical language processor that does a much better job of identifying medical terminology, opposed to a company like Dragon Nuance, which is a natural language processor. So, and then there are a few other things. Our product directly delivers the text to not only, it doesn't data dump a bunch of text into the physician's EMR, which is currently what Dragon does. And then the physician has to go and cut and paste, all of the text into the different sections of the EMR. We're vertically integrated to deliver the exact text to the correct section of the EMR. So if it's a chief complaint, that gets directed there, review systems and so on. Nice. So we've taken, so we could say, okay, well, Dragon is our competitor for dictation, for a dictation tool, but they've never begun to develop anything regarding coding or billing or anything else in the medical field. Now there's a product called Codify, which allows a medical coder to read a paragraph, identify words and cut and paste them into Codify, and Codify will kick you back a code. But again, none of that's not an AI driven platform. No. That's again, you're still, and you're hoping still the coder chooses the right word to begin with.
Stone Age.
Right. And then billing software, there are tons of billing softwares on the market, but again, most of them are for processing, right? They're just accepting a claim, attaching a fee schedule and sending it on. Our product actually scrubs that claim through another AI-driven platform, and it will get bounced back to us. It will not pass on to the payer unless there's a 99% chance that that will be accepted by the payer. So we have all of these fail-safes built in. We, have our own clearinghouse built in. We've got, revenue cycle software built in to report back to the physician, so they actually know that they're getting paid what they should have on each process. So it's pretty advanced. So again, there are competitors, as I mentioned. There's hundreds and hundreds and hundreds of billing software systems out there, but we're not seeing anyone who's taking the time to combine the three. And those billing software systems are useless if you give them the wrong codes, right? They're going to assign the wrong fee, they're going to assign the right fee to the wrong code, and it's going to get rejected. So we needed to back up and go to the beginning and make this easy enough to use so that physicians would use it, right? Accurate enough that it's beneficial to everyone, and fast enough, right? So we're even though there are competitors, none of them are really combining these three technologies to improve their software.
I love it. And I'm going to give you the last 30 seconds. And please share your email with everybody so they've got your details. And just give us 30 seconds on what you've gone through to get to this point, because every other box that we've gone through is ticked on a massive level. What you've built, size of the problem, solution that you're bringing to market, need for the market to actually do it, team that you're building around you, potential revenue that can be driven through, impact on patients, impact on specialists, and everything else around us. But what we haven't really spoken about is kind of what you've gone through personally to get you to this point since you've started. So
Okay.
finish us strong there, and give us some contact details so investors can contact you afterwards too.
So what it takes to execute a product like this is a 60 to 80 hour work week of a myopic focus on exactly what you're doing. It's going to take strong leadership. You're going to have to be able to work with a lot of different personalities, a lot of different levels of talent, and just be a risk taker. Just stay focused. Have a strong support team. I've got a brilliant team of heavy med tech, health tech advisors, in my corner. And basically, this is a product that will, disrupt the market and, really, really deliver what we promise.
I love it. And email, please, so people can just reach out to you.
Yes, you can reach me at info@sagemedical.io.
And for those people who need this to be said, that is SAGE. Okay.
Yeah.
It is wonderful, wonderful, wonderful getting you on the podcast. I could not be happier that we've had the opportunity to invest in you. The space that you're hitting is monster, as I've said 1,000 times now. And any investors that would like to talk through our diligence and what we looked on the company can also contact me at brian@expertdojo.com. This is one that you should be checking out. And that's a wrap.
Thank you, Brian.
Awesome. Great podcast. See, that's what we'll use for investors, because they can listen to it while they're going on their walk or their run or anything else. Now, Vincent, what do you need from us, buddy?
Well, I'm going to have you stop your QuickTime, Brian, and the same thing. Let's have you stop your QuickTime as well.
You
Got it.
Okay, when you stop your QuickTime, go up to File and hit Save. Careful, because it's near the delete button.
Okay.
And then go ahead and name it podcast or whatever, and just save it where you know where it is.
What do you want me to save it as, Vincent? Because
I'm save it as 8 a.m.
8 a.m. Okay, 8 a.m. And it's
Save it on the desktop. Okay, good.
Okay, sweet.
You're good, I think.
8 a.m. Sage or no?
No. The times tell me what's what.
Okay, wonderful. Okay, you got it. It's been saved. Well,